Welcome to part 2 of your Introduction to Community and Public Health video series. So let's go ahead and get started. In this video, we're going to talk about theories and models that support community health nursing and public health. Having models and theory gives us a foundation of knowledge and research and understanding in which we can build the rest of our knowledge about community and public health. Now, these theories and models we're going to discuss can really be divided into patient-centered models and community-focused models. So the patient-centered ones are really about the individual patient and improving their health, and the community-focused models are thinking about the community as the client. Now, the first one we're going to talk about is Pender's health promotion model. Now, Pender's model looks at a person's background for factors that might affect the likelihood of that person engaging in healthy behavior or behavior change. In other words, there's characteristics that are unique to each person and experiences that they've had that affect their future actions and motivations. These can be things like biological factors, their BMI, their age, gender, their ability to have good balance or aerobic capacity. There can be psychological factors like self-esteem, motivation, their perception of their own health status, and what their definition of health is for them. And there can be socio-cultural factors, their cultural beliefs and backgrounds, how much they have acculturated or not acculturated to Western care, their educational background, socioeconomic status. So these different factors all can be looked at and kind of predict the patient's likelihood in engaging in healthy behaviors or behavior change. Now, the good news for nurses is that Pender says that nursing actions can help modify these motivations. And so if we understand what might be impacting their choice or lack of choice, we can help nudge them in the direction of health. And in Pender's model, her belief is that health is about a positive state, not just the absence of disease. So in nursing, we are not just about keeping someone from getting sick. We want to actually help them improve wellness, energy, better quality sleep, better mental and emotional health. Now, in Pender's model of health promotion, there are key factors that influence health promotion and the person's ability or willingness to follow along with health promoting behaviors. Those include those personal characteristics that we just mentioned, their perceived benefit of the health promotion activity. Do they see that it would benefit them? What are the barriers? Do they have financial barriers, barriers of time, language barriers, physical ability to not be able to do whatever they're being asked to do? Do they have a belief in oneself? Do they believe that they can do it? That's called self-efficacy. And then there's the interpersonal influences from their peers, their family, and from us as healthcare workers. Some ways that we can influence have interpersonal influence is through things like social and societal norms, support, and modeling. So if you've ever been in a work environment where everyone was trying to really get healthy after the holidays, perhaps, and everyone's bringing in healthy food, it's a lot easier to eat all those healthy foods than if everyone is, kind of enjoying things and indulging. And if your break room is full of like really unhealthy food, it's a lot easier to eat those. So the support, the societal norms, the modeling of behavior can all influence the ability to work on one's health. Next is the commitment to plan. Is the patient committed to wanting to do this? And also, what are their competing demands? What else is competing for their time and energy and focus? The next model we're going to talk about is the health belief model. This is another patient-centered model that is used to explain and predict a patient's healthcare-related behaviors. Now, there's 6 essential components, and you'll see that there's some overlap between these models. So the first is the patient's perception of severity. How do they perceive the potential illness that they might get or chronic disease? Do they think it's severe or not? If you're going to get a cold, that might not be very severe, but if you might get cancer, the severity would be higher. Do they perceive their susceptibility? How likely do they think that they are to get this illness or disease? What's their perception of benefits versus barriers? So are the steps needed to prevent it worth the downsides of having to make those changes? Then there's the modifying factors, their socioeconomic background, age, gender. Cues to action. That's where we can come into play. And so how much around them are they getting motivated and hearing about it? So on the news, you might see athletes promoting getting your flu vaccine or your COVID vaccine. In the 80s, there were the drink milk commercials to improve calcium intake. So cues to action can come around us and inspire us to make change. And then finally, self-efficacy, belief in oneself, comes back into play in this model. And it really comes down to, does a patient believe that they can make the change on their own? The next patient-centered model that we're talking about here is the social cognitive theory. And this theory demonstrates that a patient's personal beliefs about their wellness, about their susceptibility to illness, about their ability to improve their wellness can really be influenced by a few things, specifically interpersonal relationships and the environment in which they are. So you'll see examples of this through things like Weight Watchers and Alcoholics Anonymous, where they have weekly meetings that are developing relationships and talking about a supportive environment, and how they'll talk at these support meetings on how do you create an environment that's going to support the changes that you want to see. That's all social cognitive theory. Now we're going to start moving into community models that really help us develop community health as a whole. Now, this trans-theoretical model is nice as a segue because it really can be used as an individual patient model or for a whole community. Trans-theoretical model talks about stages of change that someone goes through. Pre-contemplation means they're not even thinking about it, rather. Pre-contemplation means they're not even thinking about making a change. It's not on their radar. Contemplation, when you're contemplating something, that means you're thinking about something. Preparation is when you start preparing to make the change, but you haven't made it yet. Action is when change is made. Maintenance is when they're maintaining those changes, and maintenance is defined at 6 months or more. Now, maintenance can be sabotaged by different stressors or triggers that patient might have. And then finally, termination is when they are no longer making that change. So this can be applied to individuals. It also can be applied to making changes for a community. Another model that can be applied to making changes for a community is the ecological model. And this model talks about how there are different levels of influence that influence how change is made. Of course, it comes down to the individual and their knowledge and attitudes and skills, but it also talks about how they relate to others, the organizations and social institutions in the community as a whole, and how there are relationships in between community partnerships, and then public policy at the federal, national, state level where laws and regulations are made. So it takes all of these layers in the ecological model to have well-being and health in a community. The last thing we're going to talk about for models is upstream thinking. So imagine, if you would, that we're floating down a river, and you get down to the end of the river, and there's so many people that are drowning, and the current is really strong at the end, and they can't get out. And it's really difficult to go and rescue each person because there's so many people drowning where the current is strong. And so that is downstream, but way upstream, there's people who are getting into their tubes and they're going to ready to tube down the river. Well, if we can stop people from tubing down the river, they're not going to get stuck in that strong current later downstream. And it's a lot easier to say stop at the beginning of the stream than it is when they're already drowning. So community health is all about upstream thinking. It's not about necessarily rescuing the individuals. It's thinking about how do you stop those root causes to prevent those things from happening in the first place. And that's what upstream thinking is. That's going to wrap it up for part 2. Stick around for part 3. There are 4 parts in this introductory module. Thanks for studying with me. As always, remember, you are smart, you are capable, you are loved, and you got this. I'll see you next time.